Now we call upon the last presenter, Ibrahim. Prevalence of depression and cognitive impairment in post-renal transplant patients, single center study.
Good morning, everyone. I'm Dr. Ibrahim, a postgraduate from Department of Nephrology, Madurai Medical College. My study is on the prevalence and depression of cognitive impairment in post-renal transplant setting. This is a single-center observational study. There is enough evidence to suggest that there is still high prevalence of depression as well as cognitive impairment in the post-transplant period that can affect the graft outcomes. As of now, there are very few studies available on the prevalence of depression as well as cognitive impairment. So this objective of this study is to evaluate the cognitive impairment as well as the level of depression in our transplant recipients and to list out the associated factors affecting the same. So we interviewed 72 patients attending the post-transplant follow-up clinic in our Madurai Medical College, and they were given pre-printed questionnaires and depression and cognitive impairment was analyzed using the Montreal Cognitive Assessment Score and the Beck's Depression Inventory. It is a pre-printed questionnaire, and it was analyzed. The inclusion criteria, it included patients, post-transplant recipients of age 18 to 60 years. Both cadaveric as well as live transplants were included in the study. Excluded age less than 18 and more than 60 years, and particularly patients with coexisting ischemic heart disease, asthma, infections, head injuries, past history of stroke, CVA, and family history of psychiatric disorders were obviously excluded from the study. So coming on to the results of our study, we had 72 patients totally, of which the males predominated. 40 patients were male and 32 were females. Regarding the age distribution, our population predominantly had patients between 30 to 50 years. 31 to 40, we had 35 patients and more among them. Regarding the type of donor, we had 50 live donors as well as 22 donors, more the live donors. So analyzing the results, the duration of the post-transplant period included from 2 months to 18 years, and they're analyzing their graduation status. 35% of the patients were educated up to graduate. Regarding their diet characteristics, 40% still remained strict vegetarians. 35% had poor albumin levels and poor nutrition. So the mean age among our interviewed candidates, it was 35.9 years. The average time prior to the transplant on dialysis was 1.5 years, and average time since transplant was 3.2 years on the time of interview. So coming on to the prevalence of depression, which was defined as the Beck's Depression Inventory Score of more than or equal to 9, it was as high as 65% in our study. The mean BDI score, which was calculated according to the questionnaire, was 17.5. The first 13 questions were taken as a measure of the cognitive impairment. So the first 13 questionnaires had an average cognitive scale score of 12.5. And the remaining questions, which was a marker of a somatic impairment, the average somatic BDI score was around 5. Concerning the cognitive symptoms that were more common, it was the sense of failure, feelings of punishment, insoluble crying, and being self-critical were the most common complaints. Among the somatic symptoms, loss of energy and loss of libido was still present in much of the candidates. One patient with normal graft function still had suicidal thoughts. So this is the same. Among the depressed with a score of more than 9, it constituted up to 65% of our studied population, and none were severely depressed, and the mean score was 17.5. So regarding the symptom profile, as I said, the feeling of punishment, loss of energy, sense of failure, and that was the most predominant symptoms of these patients, and one even had a suicidal thought. So correlating between the type of donors and the level of depression, we found a significant association between the presence of DDRT and the presence of high BDI scores. Patients with DDRT, those who underwent DDRT transplants, had high BDI scores with a significant p-value. Regarding nutrition, patients with more BDI score with more level of depression had reduced albumin with a significant P association. So regarding cognitive impairment, which was measured with the MOCA score, up to 55% of the patients had a cognitive impairment. So on correlation, patients with higher age, recipients with male gender, recipients with low serum hemoglobin, lower level of education, and the coexisting presence of diabetes had lower MOCA score and the same. Regarding the level of BMI, blood pressure, GFR, the time since renal transplantation and time on dialysis did not have an effect on the MOCA score. So this is the same. There was significant association concerning the age, male gender, education, as well as serum hemoglobin, as well as the presence of coexisting diabetes. So coming on to discussion, in our study, the prevalence of depression was as high as 65%, whereas the other studies, it was up to 40% was observed, but we had a higher subjects with depression. And we had a significant association with cadaveric donors with depression. And the same, we were in line with the study by Mr. Friend. We had poor nutritional status as a biomarker of low serum albumin as evidenced by more depression. So much of the studies reported good cognitive, good physical as well as mental rehabilitation post-transplantation, but our study still patients had a variety of depressive symptoms as evidenced by sense of failure, punishment of feelings and crying. So this is in contrast to the other studies. So lower MOCA scores were associated with older age, male gender and low level of education. So the higher presence of cognitive impairment was more when the patient is of older age and male gender. So it is in line with other studies also. So this is the same. We had what we found that patients even with lesser age had higher rates of subtle cognitive impairment when compared with the general population, the non-transplant population. So in line also diabetes, coexisting diabetes, even presence of NODAT had a significant association with cognitive impairment in our study as line in the other studies. There was no temporal relationship between the cognition as well as eGFR. This is in contrast to the pre-dialysis CKD, where the severity of cognitive impairment is correlated with the severity of renal dysfunction, but we did not find any relation in post-transplant subjects. So concluding, the prevalence of cognitive impairment in kidney transplant recipients is still high and it is in contrast with the general population. When compared with the older population, the non-transplant recipients, even younger transplant recipients had higher prevalence of cognitive impairment as well as depression. So strategies to help kidney recipients to cope up with the deficit should be followed to prevent graft dysfunction. Thank you.
Okay. See, in MOCA score, the higher the score, the more is the depression, is it?
No. MOCA score is a level is to measure the cognitive impairment. The higher the score is good.
Better. But the opposite is true for this one.
Yes.
I think you should have explained it in the beginning. That would have made it easier for us to understand.
Sorry.
Have you looked at their socio-economic status in relation to this?
We tried to study the socioeconomic status and include it in the study, but later we dropped it because of
reason?
The reason they had poor social rehabilitation. None of our patients were.
No. I'm not talking about rehabilitation. I'm asking about socio-economic state because financial is more important, isn't it?
Yes, ma'am.
Which group of people do you cater to?
Which group of the people?
I mean, your hospital caters to low socioeconomic,
middle? Predominantly low socioeconomic status. So everyone belonged to the low socioeconomic status. So we couldn't correlate something.
Retrospectively, did you go and ask them whether they had inherently depression, which is bound to be there in the CKD individuals?
We ruled out that also, ma'am. Prior, we ruled out any significant organic psychosis, and we had a thorough investigation, prior questionnaire to rule out.
But even in dialysis individuals, they'll be more depressed as compared to after transplant status. So how have you differentiated that?
We didn't question the pre-dialysis patients, ma'am. We were more concerned about the renal transplant recipients only.
No. Her question is,
Yeah.
see, there are some people who are depressed from the time of CKD,
Yes.
and that might have been carried on
Yes, yes,
even
ma'am.
later.
Yes, ma'am.
So the transplant alone might not have changed
Yes,
their
yes, ma'am.
attitude.
Yes, ma'am.
So that's what she's
So
trying to ask.
our predominant subjects were post-transplant recipients with good graft function, free of dialysis. So that might have, we thought that would help them, impacted on the.
So your study has got only low albumin levels as such are related to
Yes, ma'am.
depression and
Yes,
other,
yes.
other things. There is no other parameter which was significantly found out.
Significant, no, nothing, ma'am. Albumin only, albumin.
So do you mean that these are all correctable with improving the status, albumin status, things will become better?
Improving the nutrition can have effects on its cognition as well as depression was our take on the study.
Okay.
Thank you. Thank you.
Oh, any questions from the floor?
Thank you.
If not, we'll conclude this session. Thank you.